Good morning, Kate Smalley here. I'm a PA with Ada West Dermatology, and I'm going to go over my morning skincare routine with you guys today. And just remember, everybody's skincare routine is going to be a little bit different because everybody has slightly different needs and slightly different skin types. We can help you figure out your skin type if you come in and do our skin type solutions quiz and speak with a provider. So personally, I have very dry skin. And a lot of people in Idaho tend to have dry skin because we live in a very dry climate. I don't have any pigment problems. Genuinely, hashtag no filter, you guys. But I still use a cleanser that has glycolic acid in it from Skinceuticals. You can also just use a regular cleanser if you want to use glycolic acid with just a regular cleanser, whatever one's appropriate for your skin type. And then The Ordinary has a glycolic acid toning solution that's really great that you can use afterwards, just as a leave-on. In general, I use medicated washes in the morning. That's not a rule. You don't have to follow that, but I generally do that because I also put topical medications on at night to prevent acne and also fine lines and wrinkles. But we'll get to that later. So step one, wash face. I've just rinsed off my cleanser. I'm going to pat dry and then immediately go for the moisturizer. I'm a big fan of Cerave's products. So I use their cosmetic line, Roche-Posay. I really like this double repair moisturizer. You can buy it in a UV form. I just think it's really has a good feel to it. It's not too heavy. It doesn't burn or sting when you put it on. Now, generally, I would avoid the eye area, but it seems like there's still some makeup left from yesterday. All right. So for me, that's step 2 in the morning. If you were going to be using a glycolic toner after your wash, you would wash, leave it on for a couple minutes, rinse it off, do the glycolic acid toner, then the moisturizer. And then the next and most important step, sunscreen. So I have 2 main sunscreens that I use depending on the day. This is one of my go-tos, the Cetaphil Liquid Mineral Sunscreen. I like it because it is a mineral sunscreen, so it does a good job blocking out UV rays, preventing skin cancer in the long run. Also prevents brown spots from forming and helps you minimize fine lines and wrinkles over the long run. But then I also have the Skin Better Tone Smart Compact. This is actually sunscreen, but it is also foundation. When you buy this, you don't actually have to pick a color for your skin. It's one color and it just matches to your skin. It's really great stuff. So if you have pigment problems, this is gonna change your life. Because for one, you're gonna be getting 68 SPF and it's going to even out your complexion really well. So I'm just gonna show you on half of my face with the Skin Better Tone Smart. If you want this compact, you have to go to the Skin Better website and then you pick the product that you want. If there's multiple products you want, go for it. This is one of the main ones that I recommend from them. And then you add it to your cart, and when you check out, you have to use Ada West as your provider. So look at that. Maybe I'm a bad person to test on because I, again, don't have really pigment problems, but Skin Better Tone Smart, it's like matching my complexion perfectly. So, but for people who have pigment problems, it will even out your complexion really well. The Cetaphil Liquid Sunscreen is going to make you hold your breath for a minute because it is a mineral sunscreen, so it has, I think, zinc oxide in it. So when you put it on, you're gonna be like, oh my gosh, I'm gonna be white. But it actually rubs in really well. And that is the last step for my face skincare routine in the morning. I said face. because what I'm also going to do is put a lot of this all over my body. Because again, I live in that dry climate, and you need a good heavy cream or moisturizer to keep your skin hydrated. So sometimes if you need something heavier for your face, it might be optimal to use it at night, and we can go over that next time. All right, a couple of things I wanted to add. I talked a lot about glycolic acid and pigment problems. I use a lot of glycolic acid for like my patients with melasma, or if you have a lot of acne scarring, the pink marks that are left after your pimples. Glycolic acid is a really gentle, great way to turn over skin cells and target pigmented cells. You can use lots of other medicated washes. One of the other two main types that you would get are salicylic acid or benzoyl peroxide, and both of those are also really great for treating acne. I really like benzoyl peroxide, but it is really drying. So if you're using other medications for acne, or if you're using retin-a, which I think everyone should, almost everyone should, then you may be getting too dry, especially if you live in a dry climate like me. So that's part of the reason why I use a lot of glycolic acid here. The other thing that I wanted to go over was that when you wash your face, you should be leaving your product on for a minute or two before you rinse it off. Give it a chance to do its job before you rinse it off. You don't have to leave it on for like 5 minutes. I typically will put the wash on my face and then maybe go brush my teeth so that it's going to be on there for at least 2 minutes, and then rinse it off. All right, we'll catch you later today and go over my PM skin routine and more products that I use